What's up, everybody? Welcome to BFR Tuesday. This is Cara, and I'm here to answer any questions that you have regarding blood flow restriction training, whether for training, for rehab, whatever that is. So if you just have a question, you can post it into the chat box, like I'll say hello from Alice. And let me know if you have any questions at all. Hi, Lewis. How are you? Keith asks, how long do you wait between sessions of exercising the same body part with BFR? It depends. If you're not taking it to failure, I typically will wait 24 hours to 48 hours. I typically do, like right now, my mesocycle is push-pull. So if I'm doing a push day on Monday, I'm not going to do another push day until Thursday, because I'll do 2 on, 1 off, 2 on, 2 off, and then repeat all that. So, there's some literature that has shown you can train with BFR, multiple times a day. But, for most of us, it's not necessary. You're going to train really 2 to 3 times a week for that body part. So, take a day off or 2 days off in between. Make sure your protein intake is adequate. And you'd have to convince me that you needed to train more often than 2 or 3 days a week. Because what I see classically is, overtraining is that leads mostly to our, tendinopathies and, other problems. Is there any consideration to, at some point, add a program to the Gen 3 unit for the passive sedentary protocol? Yeah, we've talked about it. There is for the pro version, there is a ischemic preconditioning preset. And then I teach the passive in our level 2 course, which I'm just trying to finish up right now for online viewing. I'm just lagging. So, but to actually have presets in there, that probably will never be part of the consumer version. It'll probably only be for the pro version. My pleasure. All right, any other questions before I run? I've got a patient waiting for me. Thanks. Can we use the consumer version manually for this sedentary protocol? Sure, you would just use high pressure for either upper or lower. And then you do 5, if you're doing cellular swelling protocol, which is for maintaining muscle mass during times of disuse, then you're going to do 5 minutes on, 3 minutes off for 5 rounds. And that'll help to get your cellular swelling, and that'll help maintain muscle mass during times of disuse. If you're trying to use it for pre or post exercise for recovery or performance, you're going to use high pressures, and you'll do 5 minutes on, 5 minutes off for 4 rounds. And you need to have a good amount of time before you then exercise for high performance activity. So if I was doing it before like a race or a wrestling match, I would make sure that I had at least 45 minutes after I was done with that protocol, because you deplete ATP within the tissue and you won't perform as well. Probably not as important for people of my capabilities at this time of my age, but if I was high level professional Olympic, I would wait 45 minutes before competing. All right, y'all, I got a jam, but thanks so much. Great questions today, and I will see y'all next week. Bye for now.